Hello and welcome. This is a new podcast of the American Journal of Public Health. And as usual, I'm here with Vicki Mays. Uh, and we will be moderating together this fascinating discussion with our two guests, author of a new book called Vaccinating America, The Inside Story Behind the Race to Save Life and End the Pandemic. And so we'll go over these two aspects of the title in a few minutes. I want to introduce them. We have Michael Fraser. He is the executive director of the ASTHO, which is the Association of State and Territorial Health Officers. Michael, nice to see you. Nice to have you with us. Thank you.
Thank you.
And we have here Brent Ewing, who is Chief of Policy and Government Affairs in the Association of Immunization Managers. All right.
Glad to be here.
Yeah, thank you. And so we are going to start right away with why is this book called The Inside Story?
Great question. We really felt as we thought about this project that there were a lot of books about the development of vaccine, the science of vaccine, some of the early stories of COVID. But for us, the inside story meant the real story of what public health was doing during the pandemic and all that happened both in Washington and states to make vaccination possible and to really just, I guess, shine a light on the work of public health in a way that none of the other books had done.
So we have the external picture. We saw the vaccine being produced and the shot being made, etc. And you tell us what's the mechanism that allowed everything to happen. Is this, Brent, your opinion too? That's what the inside story means?
That's what we were trying to get at. That millions, tens of millions of Americans remember going down to their doctor, to the stadium, to CVS, wherever it was that they got that first dose, felt that relief and exhilaration, but they don't know what it took to get that vaccine to that point of access. And so that's what we were really trying to share the story of the thousands of details that federal, state, and local officials had to plan and coordinate, the numerous challenges we had to overcome to get there, funding being one of the most critical ones, and just doing this in an unprecedented manner. There never had so much vaccine gotten out to so many people so fast. And the other part of the inside story is folks know that this got to them, but they don't know that it's largely a government operation. There were tens of thousands of private sector partners that were critical, but it was really planned and executed by governmental, public health, and military, federal, state, and local.
And it's actually a little bit of an ironic title because while we were on the inside, there's a theme in the book that public health was on the outside. And there was a lot of times when public health was on the outside, even on the inside. So we were playing a little bit with that in the title too.
That's right. Absolutely right. And actually, it's fascinating. I have to say that even though I knew some of it, I discovered in this book. What did you think, Vicki? You also knew a lot about it. Isn't it a revelation to go through this book and realize all the dimension of this race?
I thought it was absolutely spellbinding. It was like a book. Like we weren't reading about public health, but we were in the middle of a story of public health. And that's what I really liked is, your ability to show us people think medicine did this. And it was like public health was critical. I like, why, what led you to make sure that people understood public health? Because I think it's a major contribution when the next thing happened. So why did you want to tell that story?
Thanks so much for that. Brent and I are friends. We've been together for a long, long time. And we've all been at the same meeting where people have said, nobody respects public health. Nobody knows what public health's all about. We've been at meetings for campaigns for public health and new organizations that are going to tell the story of public health. And we just really felt like COVID was the place we could make a big splash, if you will, bring awareness to the work of governmental public health in a way that just we never had the opportunity before. And that's a silver lining of the pandemic. It's also a real problem, obviously. We can talk about that, but the ability to recognize what governmental public health did and to shine a spotlight on it just seemed like the right thing to do. And frankly, most of that was Brent. He's a very narrative storyteller. He's fantastic. So Brent should weigh in on that one too.
A partnership through and through. Mike's vision, I just had the pleasure to be part of executing it. And that was really it. We wanted, like Mike said, so many times we hear complaints. People don't get us, they don't understand us, and therefore they don't fund us. In public health advocacy, you're told, people will forget your data, they'll remember your story. So we really wanted to put the story out there and just share it and make the invisible visible. That's our goal. And we're at this crossroads right now where memories are fading quickly. We're already repeating mistakes, and the funding is already stagnant. So we really want to get out there and share the story with that eye to let's not repeat these mistakes. Let's take some of these lessons learned. This is just a small contribution. There needs to be a lot more work there. But then let's codify the lessons, because lessons learned on the shelf won't help anybody. And we want to be better prepared for next time.
We're glad to hear you really felt it was a story, because we wanted to make it a book that wasn't really wonky. There's a lot of detail that is wonky in there, but we wanted to have that narrative because, again, we wanted it to be applicable to a broad audience, not just folks that kind of got it ahead of time. So we kept joking about, is this something our moms would understand? And it kind of passed the test, not fully. I'm still talking to my mom about it.
But everyone, I think, in public health is going to be fascinating to read the story of the relationship between the Army, the White House, and CDC. I mean, and every public health person that had some expertise. And I think that's the main lesson that I personally got from that book, is that the government left the people with the public health expertise, which is something that people are trained to or don't have. I mean, it's not something you can just develop like that spontaneously, and gave all the power to the Army to organize the distribution, but left the people from public health out, and they had to manage to find a solution. So tell us a little bit more about this tension that occurred.
Yeah, I'll start. I mean, that we wanted to handle that delicately, because we started with a perspective that everybody was, focused on the mission here, doing the best they can. And in the case of the Army folks, I mean, they literally were following orders. But there was a certain hubris there of, we know how to get military supplies to the Middle East, so how hard can vaccine be? And weren't considering all the behavioral and hesitancy issues that we knew were out there, and weren't listening to the CDC and the states early on. Eventually they came around, and that's the success story is coordination improved, but late, and the understanding of the funding needed for that last mile. Public health knew that from the get-go, but it took a long time to convince the military. So we wanted to document those tensions, again, in a respectful way, not to point fingers, but to say there were mistakes made in the planning that should be taken into consideration next time. And if you have a plan, don't immediately discount it just because it's not your plan. But I get that that's human nature. But I think that's what we saw was a lot of disregard of existing plans.
I think it's a case also of something that we talk a lot about when we talk specifically about CDC, which is, their main headquarters is in Atlanta, and the action it was in DC. And, this is something that we hear a lot about, a lot of public health responses. So I think, given what CDC is doing now in terms of its modernization and transformation, I think there's a lot of interest in assuring better connectivity and even physical presence in Washington for the agency when something like this happens, which obviously we talk about a lot in the book.
So, I mean, the production of the vaccine is something, I mean, you describe it very well, etc. But just remind us, briefly, but what are the steps that public health had to do to bring that vaccine into, the most isolated rural place of America? And yet, I want to remind our listener, in my age group, 99% or CDC says 95% of vaccinated people age 65 or older. What were the steps for that?
Well, there's a lot of steps. I'll let Brent get into that because that's what his members do. But I think the point here is public health does this every day with a lot of other vaccine. The issue here was speed and scale and some of the requirements of the new vaccines that made it much more complicated. But we weren't starting from scratch. And that was part of the lesson here, the kind of the warp speed conversation early on. Didn't acknowledge what planning had gone into place and what systems were in place ahead of time. It's a lot of work. It's not just shipping boxes, as you mentioned, but I'll let Brent cover some of the steps that immunizations go through.
Yeah, I think that's the place to start is, 75 million doses of childhood vaccines annually through the Vaccines for Children program give us a great kind of structure to build upon. But that was the challenge, is how do you rapidly adapt that to the entire population? So probably don't have time to go through all the steps, but it was, building the systems to expand the prioritization, the ordering, the provider enrollment, and outreach, and really going from, I think there's about 44,000 enrolled providers in VFC. We quadrupled that to over 200,000. And so that was, I think, the main part of the challenge, and just finding how do we get it to every single corner, every state, islands, territories. And so that was the real place where creativity kicked in, and public health did things that they hadn't done previously, where it was sort of, using your existing private sector providers. There was just a lot of creativity in setting up all those mass vax sites, working with the pharmacies in a vastly expanded way that really started in 2009 with H1N1, but really came into fruition here, where we had so many tens of thousands of sites that were expanded. And then the monitoring and the communications and outreach, and that really gets into the hesitancy chapter of, where we fell short perhaps was not anticipating just how entrenched that hesitancy would become. So a lot of that is where we're focused now, is that outreach and enrollment, continual engagement, meeting people where they are, finding who are the trusted community messengers, because we know trust in government has been strained. But the good news is people still trust their provider pretty much. And so making sure that those folks are empowered. Yeah.
I mean, remember also early on, especially these were, volumes of vaccine that a lot of sites were not able to even use at first. They were getting these huge shipments, the storage requirements, the temperature requirements. Just the logistics of that alone were amazing. But the issue, I think, that we don't really talk a lot about in the book, but, if we updated it would be, there's just never going to be a one-size-fits-all approach to something like this in the future. That with 50 states and all these geographies, demographic changes, every 90% or more of the United States of population of the U.S. lives within 5 miles of a pharmacy. But if you go out to Alaska, not a lot, So they're just really thinking that through. Or a state where there aren't large chain pharmacies. There's several states that don't have that. State law around who can vaccinate had to be changed, and that took federal action. There are just myriad rabbit holes in something like this that we really wanted to capture, because it wasn't simple. Put it in a box and FedEx it. We're so used to getting our Amazon order, that day or the next day. This was massive and unprecedented, and we really wanted to tell the story as to why. Just like you said, there were thousands of details to this process.
Just, kind of ask a question based on some of the things that you're saying. And that is, I'm going to do a play on words about your title when you talk about the race. Because one of the things that we knew is race, ethnicity, gender, age, those were going to be big issues. And as Alfredo started, age for some groups got solved, faster than others. So in thinking about, particularly for a group like ASTHO that is on, really thinking through, kind of state and local level issues, what would you suggest is the lesson that's the most important in terms of reaching those rural or those, I don't use the word hesitancy, but those that, delayed in terms of getting the vaccine because of concerns that they had?
Absolutely. What we learned was the hyper local nature of this, that this was this was really door-to-door public health, literally, in a lot of places. It was folks knocking on doors, sharing information, referring people to the van down the street, that kind of a campaign. That's something that happens in public health in lots of ways, but not at this scale. And I think that's a big lesson. And how do you plan hyper local, neighborhood by neighborhood, city block by city block, and what community partners do you need to engage today in case you have to do that tomorrow? Which public health had to start with, but certainly had lots to do. And that's where our local health departments came in, our big cities, county health departments came in, and a huge focus on community-based organizations, which I think was another major lesson, the role that community-based organizations can play in scale and spread of public health interventions, and the need to do that very strategically.
I just see that's right on target, and putting equity at the center from leadership from the very top all the way down, and funding it. I think those were two of the key lessons that particularly the Biden administration, brought in an equity as central focus, made sure that there was dedicated funding to those trusted community groups. And I'll say, what we're seeing with so much turnover in public health leadership, both Mike's membership and even within the AIM membership, we've had over 50% of immunization managers are new since the pandemic started. Losing those connections to communities and community groups is something that really concerns me, that loss of institutional knowledge and trust, and knowing, if you're talking about this city, these are the key leaders you want to make sure are engaged and have the resources to reach the people that we need to. The good news is, we with that focus and funding, we've done better on equity with this vaccine than most others, and so the challenge now is how do we learn from that and sustain it, expand it.
Yeah. No, I totally agree with Vicki on that. I think that is it was a weakness of the whole campaign, and it was also related to the weakness of the surveillance system and the health monitoring system, which hopefully will be transformed. But still, as you show in the book, this is a success of public health. And let me tell you, if 65% of the country is vaccinated, the next president that is elected with 65% of the vote will hear it.
Landslide.
And she will brag about it. But we need to brag about this success. And so you say the race, to save lives. How many lives did we save?
Well,
Great news. Go ahead, Mike.
Commonwealth Fund attributes of over 3 million lives saved to the vaccine program, and which is incredible when you think about it, and also over 18 million hospitalizations avoided. So, it's pretty a success. These are large numbers.
And I'll just add that drives over $1 trillion in avoided healthcare costs, and so that's based on about $40 billion is what the federal government invested in research, development, manufacture, purchase, distribution, and administration. That $40 billion, was supported wild bipartisan margins. I think only 5 people in the entire House voted against, some of these bills. That should be held up as probably one of the best bipartisan public investments in American history to save that many lives and that much money. The challenge now is, we often say, let's reinvest some of that savings in a more stable public health infrastructure. The problem, I've been told by economists, is we have a wrong pocket problem. The money we saved, isn't sitting in some federal account. It's in less hospital spending and other things. So we're struggling now of how we make that case. But your point that this has been a great success, that was the essence of the book, is people thought, trust in government is low, but this is a place where we wanted to share that story. We could work our entire careers and probably never have the opportunity, hopefully never have the challenge again of saving that many lives in so little time.
Yeah, and to me, that's the most frustrating part of this, which is this should have been something everybody celebrated, and yet it became so political, became such a, don't have a pandemic in a presidential election year. It's going to get dragged into it. But this should have been the thing that unites us. This should have been the success that we all could celebrate, really a truly American success. And that's totally lost in the current narrative around public health and threats to public health authority and folks looking to undermine what worked. So for us, it was important to tell this story as a success, even though we did see so much suffering and so much death. There is a lot of good that happened, and we wanted to share that as well.
Well, maybe you have a book two, and book two might be, we did have a lot of successes in terms of public health, but public health still has a job, and I'm wondering what you're thinking about this, which is the job of the aftermath. So now, for example, state of California talks about 33,000 kids that were left without parents, and some of whom are moving into foster care. We have neighborhoods that, economically, we're going to stop soon. So economically, things are going to change. So maybe you can give us some inkling as to what you learned about the successes of public health in terms of vaccination and life saving that can also help us in terms of well-being.
Vicki, that one's tough because that was the hardest part of the book to write is how do you frame this as success when we've lost so many, and in particular, the hundreds of thousands that died after a free, safe, effective vaccine became available, and where's the accountability for that? And so we talked to some people, how do you begin to process that? So it's a great question. I think from my perspective, you're right. One of the first things we have to do, and maybe the end of the public health emergency that's coming up May 11th is the time to do it, is to have that national pause and say, let's memorialize all that we've lost and grieve for that, and remember those people that are left without loved ones now. And it's maybe too soon to begin to talk about that, but there's been a memorial to 9/11, to every war. We need to at least start that dialogue. Again, it might be too soon. And then we need to turn to codifying those lessons learned. That's what we owe those people, is identifying in an independent, try to get it out of politics. There's a lot of oversight happening on the Hill right now, and that needs to happen. But I think from my perspective, I'd like to see a 9/11 type commission that takes us out of politics, that studies it closely, and the book can contribute to that, but this needs to look at the entire pandemic and then commit to putting those lessons learned into policy as we did after 9/11, and make people safer in the future.
Yeah, it's a tough question. It's the question I think that we need to be asking. It's the fact that when we tell people to stay home, not everybody can do that. When we tell people to, isolate and shelter in place, not everybody can do that in a household that has lots of folks living together. And really understanding when we tell people to stay home for 10 days or 14 days, someone's got to help with groceries, and someone's got to help, and it's all of those things that were abstract. And certainly we've had experiences of in much smaller outbreaks. But, the really thinking through for the future and planning for the future, what are these, we call social determinants, what are these other cross-sector conversations we need to have to assure that when we are making these recommendations based on science, we're also thinking about really the sociology of this and the human need part of this.
Yeah, and the book covers that very nicely. I mean, you have a large section about the limitation, etc. In my view, you went too far. As you know, I'm much more positive about this experience, despite all its limitation and criticism, and we could have done better. But I don't think we ever done as well, and so I want the title say "End the Pandemic," and maybe we could end this podcast by saying, has the pandemic ended?
It's a funny thing. The pandemic was over for a lot of Americans before it was over for a lot of epidemiologists. That's for sure. And I think the sort of inconvenient truth is it's not over, and that this is now something we've got to live with and control for and think through and create new vaccines for. I think what we meant by using the word "end" was really the acuity of this, the impact of COVID, obviously a lot different over the last few months than it had been last few years. So I think it's over in that sense. But the whole narrative around the pandemic being over, really before it was over, I think is something we have to look at and really think through public health messaging in a world where people were just done with it regardless. And didn't want to wear the mask anymore and weren't going to get another vaccine. And so, it was over before it was over.
Yeah. And I don't think the WHO has declared an end. And obviously the U.S. government, the public health emergency will be ending May 11th. And again, I think, if we use that as a chance to mourn and memorialize those who we lost, let's honor the people that did this work. And that's a big part of the book. So I think that's a good place to end is where we started in the book, by thanking all of those thousands and tens of thousands of partners who played a leading role in this and got good results. 3.2 million lives saved, over $1 trillion. It's just an unprecedented and good, positive story that we wanted to share.
The health officials that have read the book and shared their feedback with me, and there've been a few, really appreciated the story being told, because there is a lot of blind sight. There's a lot of Monday morning quarterbacking going on, and people are spinning a narrative that isn't based in fact and more in hope or what they wanted to see happen. So we thought that was really important. And they also said, there were things in the book they didn't know was happening or were happening. And that was important because they wondered what was going on a lot of times too. So thanks to them, as Brent mentioned, it's really a book about public health leadership and public health professionals.
Yes. And Vicki, who would you recommend this book to?
Oh, I've already thought about that. My students are going to get parts of this book in terms of teaching. It's almost like this is the best way for me to be able to help them to understand public health, not as just, some see it as like, you go out and you do good, and they don't understand that you need partnerships. You need a lot more. And I want them to be prepared. So I'm prepared, as in my other hat of being an instructor, that students really can have the vision that you provided in your storytelling so that they know how to enter public health and be effective.
Mike and Brent, who in the world could give such a conclusion about your book? I think it's just terrific. And we're going to end with these good words from Vicki. That was fantastic. Thank you for being there. Thank you for writing such a great book. It's a very important book, and I told you, for me, it's similar to the one that was written on swine flu in 1976. You've guaranteed that the memory remains, and write another book.
Thank you.
Okay.
I don't know about
Very
that,
kind.
but thanks.
Take care, everybody. Bye-bye.
Really appreciate the kind words. Thanks for having us
Yeah.
on.
Thank
Thanks.
you.